Greetings from darkest Tokyo. It is Sunday 29th of March 2020. It's my first video update for ages. Sorry about that. This is the second day of the Tokyo semi-lockdown due to the novel coronavirus that's been spreading about a bit in Japan and also spreading about quite a lot around the world. So I'm just going to update briefly on my cancer situation if you're interested, and I'll talk a little bit about what's happening in Japan and how it affects people like me who have very compromised immune systems. In my case, it's not due to a medical condition, but it's due to the chemotherapy that I'm taking for terminal cancer. So, I recently had a full body scan, it was a CT scan, and no visible tumours at all. This is my second scan that's shown this. The previous one was about 3 and a bit months ago. So this is pretty good news. Really shows that all the treatment has been working very well. Last year I had a lot of radiotherapy and of course lots of chemotherapy as well. Now I'm on low dose chemotherapy but without any breaks. So instead of having strong chemotherapy and then a week or 2 weeks off and strong chemotherapy again, I'm having chemotherapy every other day in tablet form. But I'm on a temporary break from that starting yesterday because of the coronavirus. If someone like me gets coronavirus, I'm not sure the chances of living through that are particularly good, because I'm in that 1 or 2% of people that are very immune compromised. So I don't really have much of an immune system because it's suppressed by the chemotherapy. And even though I don't have any visible tumours, there's probably still quite a few cancer cells in my body, and maybe they are suppressing my immune system as well. It's one of the mechanisms cancer uses to survive. So obviously I know quite a few doctors and nurses here because I go to hospital or a clinic once or twice a week and have been doing so for the past 3.5 years. So talking to the doctors and nurses here, currently the situation with coronavirus is okay in Japan. The thing about epidemics is that things change quickly. The team dealing with the coronavirus here, they'll be updating their plans all the time. So we obviously can't be complacent. Japan has taken a different approach to some countries, although it's important to emphasize different countries are all using approaches that make sense in their country. Although it's one virus spread around the world, how it spreads is going to be very different in countries based on just how people live. So that's one point. Speed at which it spreads is going to vary a lot between countries. The measures that can be taken within countries is different from country to country. So it's not particularly helpful to look at what one country is doing and say we should be doing that or we shouldn't be doing that. That's just not how pandemics work. It's nonsense, really. In some countries, it may make sense to do a lot of testing to get an idea of the spread. In other countries, it makes sense to do a lot of testing to find outbreaks and track those down. Different countries will use different testing protocols. In some countries, the test for the virus will be at the end of a multi-step process, maybe involving, for example, a CT scan to see if anything shows up in the lungs, that kind of thing. So it's not massively useful to look at what different countries are doing, but I'm going to explain a little bit about what's happening in Japan. So Japan acted quite early, and many Westerners here are not aware of the extent of those actions, which is kind of interesting. And obviously I'm part of various communities, online communities and offline communities of Westerners here, so it is interesting and frustrating to see some of the things they come up with. So Japan closed the schools quite quickly, quite early, I might say. Now, when I say that, what happened was the government recommended public schools close. So in Japan, things tend to be a recommendation. This is for legal reasons. This is how the legal framework of the country has been set up. And there may be issues around that, but I might discuss those in another video. So schools closed quite quickly. Many public schools followed that advice. Many private schools did the same thing. So there's been many schools, particularly around Tokyo, closed early on, weeks and weeks ago. But many other things closed down in Japan that some of the non-Japanese here might not be aware of. So, for example, the libraries closed, community centres closed. Both of those are quite significant because there are many community centres all over Japan, and they are often used by the elderly who may be particularly at risk from coronavirus. I volunteer for a non-profit organisation in Yokohama, and we were told again weeks ago, we were just asked, please stop all indoor events immediately, which we did, and it seems that other NPOs did the same thing. We had quite a lot of events planned. It's quite significant, I said, indoor events. So in Japan, the thinking has been that most outdoor activities are okay. Now, I should point out that in Japan, I think there's like a viral epidemic every single year, and in fact last year was the worst one we had for about 20 years. And of course we were affected by this SARS outbreak, which I think was 2003. So there's a lot in place in Japan, again, that many people wouldn't be aware of. There's a lot of disease tracking and disease surveillance all over Japan that people wouldn't have any awareness of at all unless either you were directly involved, or in my case, I know lots of doctors and nurses, so I hear about these kind of things, and I'm particularly curious about this kind of stuff because coronavirus is potentially very dangerous for me. So I've been asking about this kind of thing, how these surveillance systems work, what the screening is like around airports. I think Japan has had infectious disease screening at all ports and airports. I think it's been 17 years. So this is like thermal imaging cameras and verbal questioning, this kind of thing. Not massively effective, but combined with all the other measures in Japan, this kind of thing might be quite significant. So, just for possibly a superficial example, some of my friends in New York say that the sort of coronavirus pandemic has been the first time that they've seen subway train stations cleaned in the daytime. So in Japan, a lot of that kind of stuff happens all year round, and in winter happens even more so. So for example, the hospitals and clinics I've been to and many of the public buildings will clean door handles twice a day, all year, as a routine thing. And interestingly, we have many doors in Japan don't have door handles. It's quite a sort of culture shock when I go back to the UK and I'll be standing in front of a door wondering why it doesn't open. When, of course, in Japan, many doors are going to be automatic. And it could be that the spread of coronavirus on surfaces is significant. The three kind of current ways of spreading that are being looked into are droplets, kind of vapor, and surfaces. Now in Japan, the medical consensus here seems to be that a key cause of the spread could be vapor or droplets in poorly ventilated spaces. So, for example, I have to go on the subway train to hospital for cancer treatment every week, and I go on a train line that's usually quite crowded when I go into central Tokyo. It's been a lot less crowded recently, but also windows are open, ventilation is on strongly. There's been announcements apologising for the inconvenience. So those are the measures in Japan. The focus here has been very much not trying to limit the spread of coronavirus from person to person, but instead trying to limit it spreading from one person to many people in a short space of time. So sort of trying to prevent outbreaks, and when outbreaks happen, tracking them down. There hasn't been much testing here compared to other countries, although it's very difficult to compare testing between different countries because different countries different countries select people for testing in different ways. World Health Organization has basically issued guidelines saying you should test based on three things. One is, has this person, are they likely to be infected by the coronavirus? So have they been in contact with someone who's tested positive? Another fact to consider are the symptoms. This is very tricky because the symptoms are things like runny nose, fever, dry cough, aching. One of the useful symptoms seems to be losing your sense of smell. But yeah, symptoms are not particularly reliable, at least alone. And the third thing is the epidemic situation. I get local local epidemic situation. So, if someone has no symptoms and there's no reason to think that they've met someone with coronavirus, but because maybe they've been self-isolating for whatever reason, but they're in an area where loads of people around them are testing positive, then that might be grounds to test someone. So those are the WHO guidelines on who to test. I know in Japan, relative to other countries, there hasn't been so much testing. The current test, the swab test, has a very, very low false positive rate. That means if it says you've got the virus, if it says virus is in your body, then basically it is. But the false negative rate is quite high. I believe that's not because of an error in the kind of the reaction in the test or whatever, which is the reverse transcript polymerase chain reaction, RT-PCR, I guess. But it's just because you're taking samples from someone and checking for, is there cells, is there RNA from the virus or bits of RNA from the virus. You could swab someone's nose and not find any evidence of the virus, but it could be deep in their lungs. It makes sense to do several tests per person. This has kind of led to some confusion early on in the media because there were countries reporting how many tests they were doing, i.e. how many swabs were being tested, and other countries or other areas of the same country even reporting how many people were being tested. So the number of tests might be 2 or 3 times the number of people. Japan has, I think they've got more CT scanners per person than any other country, and diagnostic radio imaging here is incredibly advanced and incredibly quick. So it may also be that that's a big part of how testing is being organised here, because if you look at CT scans of the lungs, there are kind of telltale things that show it's probably, I guess, fibrosis caused by the coronavirus. I think they're like glass granules. Yep. So anyway, testing is a one aspect of how you deal with coronavirus, and at the moment, with no vaccination available and no specific treatment available, testing, kind of mass random testing, is not necessarily a good thing. Japan's approach has been to work hard to protect the hospitals from overrunning. It's very difficult for most people to understand, but if things get really bad, yes, there'll be a lot of deaths due to people contracting the disease COVID-19, which is the one that this novel coronavirus causes. But if hospitals are overrun, meaning things like hospital waiting areas are crowded with people sick with coronavirus and people sick with other things, if medical staff and non-medical staff in hospitals don't have access to enough personal protective equipment, the N95 masks or N99 masks and all the other things they need, then there'd be many, many more deaths, not people dying of coronavirus, but people dying from many other things. So that's, I think, one of the reasons why Japan's approach is really focused on preventing hospitals getting overrun. I believe at this moment there's still the policy of hospitalise anyone who is tested positive for coronavirus using the RT-PCR test. I think that's actually a WHO recommendation. They say, if possible, anyone testing positive should be treated in a hospital or a clinic. I would imagine that policy is going to change soon in Japan. If it hasn't already changed, there's going to have to be some triage with that, kind of sorting out, sending non-serious cases for self-isolation at home. Japan has 12 or 13 hospital beds per 1,000 people, compared to, I think, the UK and the US are something like 4 hospital beds per 1,000 people, and those differences are very, very significant because there are trigger points that cause hospital overrun. So it's not just like having 3 times more beds. It might, in practical terms, give you sort of 10 times more leeway or whatever. So yeah, we'll see what's going to happen in Japan. There has been a quite distinctive rise in COVID-19 tests during this, people testing positive during this week, and it is hoped that that is a result of the 3-day weekend we had last week. So to sort of see if that is the case, there's been this semi-lockdown in Tokyo this weekend where people have been told to stay at home, not go out to restaurants and things. It will take 2 weeks to see that. So kind of takes possibly 2 to 14 days for symptoms to appear. Currently, that's the sort of range people have been talking about. So that means, realistically, to control epidemics and pandemics, you have to take the course of action you believe to be correct and then see what happens. It's maybe not a message people like to hear, but that's the reality. There's been a lot of kind of fantasy talk in the media and social media, modelling and projections and all this kind of thing. That's based on assumptions that are not necessarily connected to reality, because we don't know the reality yet, and things like seeing peaks, it's just like Hubbard's oil peak, right? You see the peak. Once it's passed, you can look back and say that was the peak, and even then, you may be looking at a local feature on your graph. So I will do a more maybe I'll do a more detailed corona update soon. Just some personal news. So I'm just started a temporary break from chemotherapy because my immunotherapist thinks my immune system is particularly weak at the moment, based on some medical evidence. So he said it's probably best to take a break and Incredibly, thanks to your very, very generous donations, basically over kind of the past 4 and a bit months, I'm now getting enough funds from your donations to have immunotherapy again. So I'm having that scheduled for a few weeks' time. The type of immunotherapy I have happens to protect very strongly against viral infections, because part of my treatment uses NK cells. NK cells. These are the natural killer white blood cells. These can attack cells that are infected, but that are not presenting antigens. And yeah, so basically NK cells can attack. I mean, that's what attacks viruses that your body hasn't previously been exposed to. When you've been exposed to a virus and hopefully recovered very well from it, then you can then your body's immune system will use I think it's the T cells that will know about the virus signature essentially and will attack it. But for viruses you haven't been exposed to, it's the NK cells that are really important. Just one more small point on coronavirus. There's been a couple of reports in Japan of people being reinfected. There's been several reports in the media about reinfections. I can say pretty categorically that there are no confirmed cases of reinfection. It may be possible to be reinfected with coronavirus, very, very unlikely, may be possible. If reinfection is possible, it would tend to happen in people like me with very suppressed immune systems. So the cases in Japan are down to the false negative rate on the testing. So basically someone had symptoms or was exposed to coronavirus and was therefore tested positive. They recovered either with treatment or without a supportive treatment, not a specific treatment for COVID-19. Then they test negative, but that's a false negative. And then later on, either they're tested again for some other reason, or the symptoms return and they're tested again. So you're getting a positive test and a negative test and a positive test, but the middle result is a false negative. So yeah, currently there are no confirmed cases of reinfection. And hopefully this isn't something where people will be reinfected. Another thing I'm hoping for is that children are poor spreaders. We know that children can definitely get infected because there have been cases of that, of children being diagnosed with COVID-19, but hopefully they're poor spreaders, they're not particularly infective. This will be because of how the disease cycle works, with maybe sudden appearance of maybe sort of early appearance of symptoms, and then they get better quickly and they're not very contagious for the period afterwards. That remains to be seen and is being researched at the moment. So that's obviously a key consideration when people talk about should schools remain closed or should be opened here. Okay, another update soon. Thank you so much for listening, and please subscribe. And thank you for the donations. They are keeping me and my wife alive because she has cancer too, and although her cancer is early stage, it's not stage 4 terminal cancer like mine. Her cancer is aggressive. She has a what's called clear cell carcinoma, and the three traits are that three traits of clear cell carcinoma are resistant to chemotherapy, tends to return, and also tends to spread. So the immunotherapy is really important for her too. Thank you so much. Really appreciate your time, and more updates soon.